NRS 4026 Nursing Capstone, Clinical Instructor Roles and Responsibilities. Welcome, and thank you for serving as a clinical instructor for NRS 4026 Nursing Capstone. Make note of your FOR. Your role as a clinical instructor is essential in supporting students during their final transition from student nurse to professional nurse. This course emphasizes clinical immersion, accountability, leadership, and readiness for practice, and clinical faculty play a central role in ensuring students meet these expectations safely and successfully. This presentation outlines your core responsibilities, with a focus on clear communication, documentation, and early intervention throughout the semester. One of your first and most important responsibilities is ensuring clear, proactive communication about clinical scheduling. Students are required to coordinate proposed clinical dates with their preceptor, enter all proposed dates into Exxat at least 1 week in advance, request clinical instructor approval before attending the clinical setting. Students may not begin clinical hours until those dates are reviewed and approved in Exxat. As the clinical instructor, you are responsible for reviewing all proposed clinical dates carefully, confirm alignment with course requirements and clinical hour expectations, reject any proposed clinical dates that conflict with other nursing courses, labs, simulations, or required academic obligations during the semester. Approve only schedules that keep the student compliant with all program requirements. If conflicts exist, the student must revise and resubmit dates before entering the clinical setting. Clear enforcement early prevents attendance violations and end-of-semester issues. Students must log each clinical day worked in Exxat immediately following their shift. As the clinical instructor, you should monitor logs for accuracy and timeliness, address missing or late entries promptly, reinforce expectations early to avoid cumulative errors. Repeated late or missing documentation may result in failure of the clinical component. Clinical instructors are responsible for initiating professional contact with the assigned preceptor. This initial outreach should establish collaboration, clarify learning objectives, review expectations for communication and evaluation, confirm preferred methods of contact. This connection supports shared accountability and sets a strong tone for the semester. Each student must be visited at least twice during the semester by their clinical instructor. These visits include direct observation of the student in the clinical setting and meeting with the preceptor to discuss student performance, assessment of progress toward clinical competencies. Additional visits may occur if concerns arise. All visits must be documented and used to support evaluation decisions. Students complete 2 clinical journal reflections during the semester. Clinical instructors are responsible for reviewing and grading both reflections and providing meaningful, constructive feedback. Ensuring reflections demonstrate engagement in weekly clinical experiences, continued learning and skill development, critical thinking and professional insight, use of sources or evidence when appropriate. These reflections serve as direct documentation of learning and may be used to support clinical evaluation tool grading. Preceptor feedback is a required component of student evaluation. Clinical instructors must distribute the preceptor evaluation form twice during the semester, once at midterm and once at final. Review feedback carefully. Discuss results with the student. Use feedback to support CET competency ratings. This ensures evaluation reflects multiple perspectives. Clinical instructors are fully responsible for completing the clinical evaluation tool in Exxat. Important reminders: all competencies must be met by semester end. Any competency marked needs improvement at final results in clinical failure. CET ratings should be informed by clinical observation, student documentation, reflections, preceptor evaluations, and ongoing communication. Midterm and final evaluation conferences are mandatory. Failure to attend conferences results in clinical failure. Attendance policies for NRS 4026 are firm and must be enforced consistently. Attendance is required for all clinical and simulation experiences. Arriving more than 15 minutes late counts as an absence, and missing more than 20% of required hours results in clinical failure. Students must notify their preceptor, clinical instructor, the faculty of record, and the simulation coordinator when applicable. Unexcused absences have consequences. 1 results in a grade reduction, and 2 result in course failure. All attendance concerns should be addressed early and documented promptly. Consistent documentation protects students, faculty, and the program. Clinical instructors are expected to monitor Exxat regularly, address concerns early, document communication and performance concerns, maintain professional, timely feedback. Clear documentation supports fair evaluation and successful course completion. Clinical instructors are strongly encouraged to communicate early if any concerns arise. This includes performance issues, attendance concerns, documentation problems, communication challenges, or any situation that may escalate. In such cases, please contact your FOR as soon as possible. Early communication allows us to support students appropriately, guide faculty, and resolve concerns efficiently. The earlier a problem is identified, the quicker and more effectively it can be resolved. You are not expected to manage challenges alone. This course is built on collaboration and shared responsibility. Your FORs are here for you and only a text or email away.